Over time, there have been significant changes in both the ASD diagnosis criteria and treatment methods. Today, observational screening procedures that assesses a child's social and cognitive skills are mostly used to make diagnosis. The DSM-5 and M-CHAT are the two primary diagnostic instruments used to establish an ASD diagnosis. These measures look for enduring problems in social interaction and communication, as well as replies to yes/no questions covering several development areas. Treatment options, which may include behavioral therapy, drug usage, and nutritional supplements, depend on the severity and co-morbidities of the condition. Today, we'll talk about the diagnosis and treatment for autism disorder expository. Welcome to Autism Answers. We talk about autism with the goal of sharing knowledge and bringing awareness to light. Our goal is to make videos that are easy to understand so many will be able to understand and develop a deeper awareness of autism. With that said, we'll get into it. A neurodevelopmental illness called autism spectrum disorder is characterized by difficulties in social interaction and communication, as well as the prevalence of constrained, repetitive activities. Social communication deficiencies can manifest in a variety of ways, including difficulties with shared attention and social reciprocity, as well as difficulties using verbal and nonverbal communication skills for social engagement. Confined repetitive behaviors, interests, or activities include stereotyped, repetitive speech, physical movement, or item usage, rigid adherence to routines, restricted interests, and hyper and/or hyposensitivity to sensory input. In 1908, Eugene Bleuler coined the term autism to characterize signs of acute schizophrenia, hallucinations, and unconscious imagination in babies. Since then, the taxonomy, diagnosis, and meaning of autism has all shifted dramatically. ASD was defined between the 1940s and the 1980s as irregularities in language development, the exhibition of ritualistic and obsessive behaviors, and disruption in interpersonal interactions. Sensory impairments in infancy was observed in autistic infants in the 1970s and became a distinguishing hallmark of ASD. Autism was listed as a subgroup within the diagnostic category of pervasive development disorders, PDD, in the third edition of the American Psychiatric Association's APA Diagnostic and Statistical Manual of Mental Disorders, DSM-3, in 1980 to convey the view that there is a broader spectrum of social communication deficits. Asperger's syndrome, named by psychiatrist Lorna Wing, who originated the phrase in 1976, is an ASD named after Hans Asperger, who originally reported its symptomology in 1944. Wing hypothesized in 1981 that autism is part of a larger set of diseases that share characteristics such as speech, creativity, and social relationships. In 1994, Asperger's syndrome was finally added to the DSM-4. Work by Simon Baron-Cohen, Jutta Frith, and Alan Leslie in the mid-late 80s led to the conclusion that autistic children lacked theory of mind, or the ability to assign mental states to others and oneself, which is a fundamental component of social interaction. Autism was officially recognized as a disability in 1990. Due to the difficulties in identifying and differentiating between the various PDD, DSM-5 and the International Classification of Diseases 11th revision employ ASD as a blanket category and differentiate people using clinical specifiers and modifiers. Our understanding of the pathophysiology, etiology, and behavior of ASD is constantly evolving. ASD is now well recognized as a relatively common disorder that needs lifetime assistance for many, but not all people. Let's discuss the steps and possible processes of identifying diagnosis. ASD has historically been associated with poor social relationships, verbal, nonverbal communication difficulties, and constrained repetitive behavior patterns. These essential characteristics are observed regardless of race, ethnicity, culture, or socioeconomic background. However, because ASD people differ from one another, one trait may be more prominent than another. Despite recent advances, there are no viable biomarkers for ASD at this time. As a result, today's clinical diagnosis of ASD is based on analyzing behaviors in accordance with the APA's DSM-5 criteria. Other conditions that may concur with ASD, these include mental problems such as attention deficit hyperactivity disorder, ADHD, which is the most prevalent comorbidity among persons with ASD, 28%, as well as other symptoms and diseases such as anxiety and phobias, dissociative disorders, depression, bipolar disorder, and episodic mood disorders. Before we continue, we'd like to ask for a few moments of your time. If you want to support Autism Answers and its mission to spread awareness about autism, please leave a like and click on the subscribe button. This would help us create more engaging content for you. Now, moving back to where we left off. Let's say it's your child. During frequent checks, the doctor will search for symptoms of development delays. If your child exhibits any autism spectrum disorder symptoms, you'll most likely be directed to a specialist who treats children with autism spectrum disorder. such as a child psychiatrist or psychologist, pediatric neurologist, or developmental pediatrician for an examination. Making a diagnosis of autism spectrum disorder can be challenging due to the vast range of symptoms and severity. There's no specific medical test that may be used to diagnose the disease. Rather, an expert may observe your child and inquire about how his or her social interactions, communication abilities, and conduct have evolved over time. Give your child hearing, speech, and language testing as well as assessments for developmental level and social and behavioral concerns. Give your child scheduled social and communicative encounters and grade their performance. Use the criteria for the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, DSM-5. Include additional specialists in the diagnosing process. Recommend genetic testing in order to determine whether your child has a genetic disease such as Rett syndrome or Fragile X syndrome. Early signs and symptoms. Because of the possible link between early intervention and enhanced development of children with ASD, early diagnosis and evaluation of ASD in children has become an important public health goal. Early presentation of ASD is frequently caused by parental worries, prompted by identifying some of the previously mentioned ASD hallmarks, which has grown owing to the increased knowledge of ASD hallmarks among parents, healthcare specialists, and child care workers. Some video studies show that ASD signs may be seen in youngsters as early as 6 to 12 months old. There's a growing interest in tracking the appearance of ASD prodromes in their first year of life, such as impaired motor control or atypical social development. Now, how about a cure or a treatment? There is no cure for autism spectrum condition and no one-size-fits-all treatment. The objective of therapy is to improve your child's capacity to function by minimizing symptoms of autism spectrum disorder and prompting growth and learning. Early intervention throughout your child's preschool years can help them gain important social, communicative, functional, and behavioral skills. The variety of home-based and school-based autism spectrum disorder therapies and interventions available may be bewildering, and your child's requirements may vary over time. Your healthcare physician might suggest solutions and assist you in locating services in your region. If your kid has autism spectrum disorder, consult your specialists about developing a treatment plan and assembling a team of professionals to fulfill your child's requirements. Treatment options may include communication and behavior treatments. Many programs address the social, verbal, and behavioral issues that are common in autism spectrum disorder. Some programs emphasize problem behavior reduction and the acquisition of new abilities. Other programs educate children how to behave in social situations or how to communicate more effectively with others. Through a reward-based incentive system, applied behavior analysis (ABA) can assist children in learning new skills and generalizing these skills to a variety of settings. Educational therapies. Highly organized educational programs frequently work successfully for children with autism spectrum disorder. A team of professionals and a range of activities to develop social skills, communication, and conduct are often included in successful programs. Children in preschool who get intense tailored behavioral therapy frequently make significant progress. Medications. There's no drug that may treat the core features of autism spectrum condition. However, many medications can assist regulate symptoms. For example, if your child is hyperactive, certain medications may be administered. Antipsychotic drugs are occasionally used to address severe behavioral issues, and antidepressants may be prescribed for anxiety. Keep all of your child's healthcare professionals up to speed on any drugs or supplements he or she is taking. Some drugs and supplements might interact, resulting in potentially serious adverse effects. Family therapies. Parents and other family members may learn how to play and connect with their children in ways that improve social interaction skills, problem behavior management, and the teaching of daily living skills and communication. Other therapies. Depending on your child's capabilities, speech therapy to enhance communication abilities, occupational therapy to teach activities of daily living, and physical therapy to improve mobility and balance may be all effective. A psychologist can advise you on how to deal with problematic conduct. And that's what we have for you today. What are your thoughts? Let us know in the comment section down below. If you want more content related to this topic, make sure to check out our channel. Take care, and we'll see you in the next video.